Welcome back to the deep dive. Today, we're jumping into something really important, especially for MSRA prep, but honestly, just vital clinical knowledge, carbon monoxide poisoning.
Absolutely. It's one of those things you really need to have on your radar.
Yeah, so this is going to be your focus guide, hitting the key points you need for recall definition, causes, how it works, how we spot it, how we treat it.
hmm The mission is clear. Nail down CO poisoning so you can recognize and manage it confidently.
Exactly. So let's start right at the top. What is carbon monoxide poisoning, fundamentally?
Well, simply put, it's what happens when you inhale too much carbon monoxide gas. It's potentially life-threatening because it seriously interferes with your body's ability to transport and use oxygen.
Right. Oxygen delivery is the core problem. It leads to hypoxia, basically starving your tissues and cells of oxygen.
Precisely. And that cellular dysfunction is where the danger lies.
Okay, so where does the CO gas actually come from?
It's a product of incomplete combustion. So anytime you burn fuels containing carbon, think gasoline, natural gas, wood, coal. If they don't burn completely, they can release CO.
And what are the typical situations where someone might get exposed?
Oh, common sources include things like faulty heating systems, furnaces, boilers, that kind of thing. Vehicle exhaust is a big one, especially if a car is running in an enclosed space like a garage.
Right.
Also, gas appliances like stoves or water heaters if they're not properly vented or maintained. And, of course, smoke from house fires.
Makes sense. So who's particularly at risk then?
Well, the environment is key. Poorly ventilated or confined spaces dramatically increase the risk. Using things like portable generators, grills, or camping stoves indoors is a major hazard.
Yeah, definitely shouldn't do that.
No. And then there are occupational risks. Firefighters, miners, mechanics, construction workers might have higher exposure levels.
Okay, let's get into the mechanism, the pathophysiology. How does CO actually harm the body once it's inhaled?
This is the crucial bit. CO has this incredibly high affinity for hemoglobin in your red blood cells, much, much higher than oxygen.
Like hundreds of times higher, isn't it?
Exactly, around 200, 250 times higher. So it binds really strongly, forming carboxyhaemoglobin, COHb. This means there's less hemoglobin available to carry oxygen.
So it directly reduces the blood's oxygen carrying capacity.
Yes, but that's not all. It also binds to myoglobin in muscles,
Yeah.
affecting oxygen use there, and critically, it inhibits cytochrome oxidase.
Ah, the enzyme, the mitochondria, essential for cellular respiration.
Precisely. So it disrupts oxygen use at the cellular level too, causing tissue hypoxia that way. And prolonged exposure can trigger inflammation, oxidative stress. It's quite systemic.
Okay. If someone presents unwell, maybe confused or breathless, what else are we thinking about? The differentials.
Good point. You definitely consider other causes of hypoxia, maybe a pulmonary embolism, severe asthma, or even severe anemia.
Neurological causes too.
Yes, absolutely. Conditions causing altered mental status or headache, like meningitis, stroke, or even migraines, could be on the list initially, especially given how vague CO symptoms can be.
How common is this? What's the epidemiology look like?
It's unfortunately quite common worldwide, a leading cause of unintentional poisoning deaths, actually. Thousands of cases happen every year.
And is there a seasonal pattern?
Very much so.
Hmm.
It peaks in the colder months. People are using heating systems more, windows are closed. It increases the risk of CO building up indoors.
Right. Let's talk symptoms. What does it actually look like when someone comes in?
The real challenge here is that the symptoms are often nonspecific. They can vary a lot depending on how much CO they were exposed to and for how long.
So things like,
Headache is very common, often described as dull and frontal. Dizziness, nausea, vomiting, feeling weak or fatigued, confusion. Those are classic early signs.
kind of flu-like almost.
Exactly, which can lead to misdiagnosis initially. In more severe cases, you might see loss of consciousness, seizures, coma, signs of myocardial ischemia like chest pain or respiratory failure.
So how do we nail the diagnosis? What investigations are key?
The diagnosis relies on a combination of clinical suspicion, getting that history about potential exposure to the symptoms, and crucially, measuring the carboxyhaemoglobin level in the blood.
That's a blood gas test usually.
Yes, an arterial or venous blood gas analysis will give you the COHb level. You might also see metabolic acidosis on the blood gas in significant poisoning.
And what about pulse oximetry? Can we rely on that?
That's a really important pitfall. Standard pulse oximeters cannot distinguish between oxyhemoglobin and carboxyhemoglobin. So the SpO2 reading might look normal or falsely high, even when the patient is severely hypoxic from CO. You need that COHb level.
Crucial point. Okay, management. Someone comes in, you suspect CO poisoning, you've confirmed it. What's the first move?
Priority 1 is immediate removal from the source of CO, if that hasn't already happened. Then high-flow supplemental oxygen, usually 100% oxygen via a non-rebreather mask.
That helps displace the CO from hemoglobin.
Yes, it speeds up the elimination of CO significantly. For more severe cases, say loss of consciousness, neurological signs, evidence of heart damage, or very high COHb levels, or if the patient is pregnant, hyperbaric oxygen therapy, or HBOT, should be considered.
Right, putting them in a high-pressure oxygen chamber.
Exactly. HBOT dramatically accelerates CO elimination and helps get oxygen delivered to tissues under pressure. Beyond that, it's supportive care monitoring cardiac rhythm, treating seizures if they occur, managing coma, correcting acidosis.
What about the prognosis? What's the outlook?
It really depends heavily on the duration and severity of the exposure, and importantly, how quickly treatment was started.
So mild cases.
Mild cases caught early and treated promptly with oxygen generally have a very good prognosis. Full recovery is expected.
But severe cases.
Severe cases, especially those involving coma or significant neurological impairment initially, carry a risk of long-term problems or even death, unfortunately.
What kind of long-term complications should we be aware of?
Neurological sequelae are probably the most concerning. Things like cognitive impairment, memory problems, difficulty concentrating personality changes, movement disorders like Parkinsonism can develop, sometimes weeks after the initial poisoning. It's called delayed neurological sequelae.
Wow, weeks later.
Yes. And cardiac complications can also occur, like arrhythmias, heart attacks, or worsening heart failure, particularly in people who already have heart conditions. Less commonly, you might see issues like cerebral or pulmonary edema or barotrauma from HBOT, though that's rare with broader protocols.
Okay, so wrapping up, the absolute key message seems to be suspect it early, especially with those vague symptoms in the right context, and treat it fast with oxygen.
Couldn't say it better. Prompt recognition and management are critical.
All right, time for a quick memory tip. Think of CO as the silent intruder. Maybe picture a faulty boiler silently filling a room. It helps remember the insidious, odorless danger.
Good one.
And a revision question for you listening. A patient presents in winter with a headache, feeling sick, and generally unwell after spending time indoors. What environmental factor is top of mind, and what single investigation is most crucial for diagnosis?
That hits the key points. And maybe a final thought to ponder. Given how common and preventable this is, are our public health messages about CO detectors and appliance safety actually hitting home effectively enough?
Definitely food for thought. For more excellent MSRA revision resources and deep dives like this, do check out pastthemsra.com and also freemsra.com.
Great resources.
Thanks for tuning into the deep dive.